Did you know that heart disease is the leading cause of death in the United States? According to the CDC, one person dies every 30 seconds in the US from heart disease. What exactly is heart disease? Well, heart disease is a very broad category that describes different heart problems such as coronary artery disease, high blood pressure, cardiac arrest, strokes, and more. Heart disease is a buildup of fatty plaques in your arteries or that can eventually damage your blood cells and heart. Plaque buildup causes narrowed or blocked blood vessels that can lead to a heart attack, chest pain, or stroke. What are the risk factors associated with heart disease? The high blood pressure, high blood cholesterol, and smoking are all key risk factors for heart disease. Many other medical conditions can also put people at higher risk for heart disease. These risks include diabetes, obesity, an unhealthy diet, and physical inactivity. Currently, the key factors to prevent heart disease are controlling blood pressure, keeping cholesterol levels low, eating healthy, and exercising daily. There are general modes of prevention the doctor will explain to a patient, but it is not always easy for the patient to actually accomplish. Everyone in the time of a pandemic right now is virtual, so it makes everything even harder. A quick fact is that COVID-19 has actually indirectly caused a rise in the cause of patients with cardiovascular disease, as fewer people were being diagnosed. Hospitals were strictly for COVID-19 patients, which put people at higher risk, even as diagnoses went down. There was a rise in heart disease due to patients developing wrong eating habits and lack of physical activity. How do doctors detect heart disease? Well, heart disease, doctors will use an ECG, take a stress test, an echocardiogram, a CT scan for the heart known as cardiac computerized tomography known as a CT scan, or an MRI for the heart known as cardiac magnetic resonance imaging, and a few other similar tests. In addition, laboratory tests include blood tests to determine your risk of heart disease to evaluate other systems of your body that can affect your health. These are all ways to potentially protect you from heart disease, but is there a direct way to lower the chance of heart disease quicker? The answer is possibly. A possible option is leveraging the field of nanotechnology to potentially detect cardiovascular disease at the earliest stages. Nanotechnology is the control of matter on the molecular scale, normally 1 to 100 nanometers. Working on a smaller scale could directly target the plaque in the arteries and help signal to doctors the risk of heart disease quicker. These plaques can clog and damage the arteries, which limits or stops blood flow to the heart muscle. If the heart does not get enough blood, it cannot get enough oxygen and nutrients it needs to work properly. This can cause chest pain, or a more severe side effect is heart attack. In addition, using nanosensors could also help increase blood flow. If you've read my past article, I talk about how in the past researchers have used nanosensors to inject insulin needed for type 1 diabetic patients. These nanosensors are made from a gel-like structure that senses glucose levels in the body and respond by creating the appropriate amount of insulin, thereby replacing the function of pancreatic islet cells, which are destroyed in type 1 diabetes patients. The gel contains a mixture of oppositely charged nanoparticles that attract each other. This keeps the gel intact and prevents the particles from drifting away once inside the body. For heart disease, the same gel-like sensor could be applied to this and focus it on monitoring the blood cells. In addition, since heart disease is caused by plaque buildup in the wall of arteries that supply blood to the heart, called coronary arteries, possibly having these sensors respond by breaking down the plaque. Plaque is made up of cholesterol deposits. Plaque buildup causes the inside of arteries to narrow over time. So if we eventually have these sensors, it can monitor and signal to doctors before heart disease actually develops. So now I'm going to be talking to you about how this sensor would actually work in your body. If a doctor sees the first signs of heart disease, such as high cholesterol, obesity, etc., they could proceed to request a nanosensor to be placed in their body. Throughout the week or few months, depending on the severity of the symptoms, the sensor would be monitoring the blood vessels around the heart so the plaque does not build up too much to cause heart disease. If the buildup starts, this would indicate a sign of the disease, and the doctor can then monitor the signs even more before heart disease actually develops. The sensor would be placed in the coronary artery depending on the severity of the symptoms. Another potential application for nanosensors to prevent heart disease could be monitoring blood flow, since the plaque buildup can cause a stop of blood flow, leading to heart attacks. Over the last few years, active nanosensors designed for disease diagnosis from in vivo has been created. In vivo sensors work with interactions with different molecules in the body and activate with target interactions, so we know this is possible from these in vivo sensors. In vivo nanosensors are another option that could be applied to detect cardiovascular disease earlier on in order to help with blood flow and plaque buildup. So that is an option for using implantable nanosensors in the body to protect heart disease. Using nanosensors to prevent heart disease earlier is a potential option for the future. The key to preventing almost any disease is to target the symptoms at an earlier stage. The earlier, the better. For heart disease, there's no direct way to directly eliminate currently. Eventually, using these nanosensors to detect the symptoms of heart disease would leave more time to treat the symptoms before heart disease actually becomes worse or fully develops. By using nanosensors, the arteries won't get clogged to cause a disease, which could lead to serious effects such as a heart attack. Once there's more research conducted, hospitals could start using this eventually to lower the mortality rate for the disease. Thank you so much for listening, and check out my article on Medium to learn more.